Hello everyone, and welcome. In today's 200 CNA question and answer practice exam practice session, we'll go through 307 updated questions designed to help you prepare for the exam. When each question appears, pause the video first. Choose the answer you believe is correct, then comment your answer below before resuming the video to see the correct answer. Keep track of your score as you move through the questions, and let's get started. Question 1. What is the medical definition of dysphagia? Option A. Difficulty speaking. Option B. Difficulty swallowing. Option C. Inability to urinate. Option D. Painful digestion. The correct answer is option B. Difficulty swallowing. Explanation. Dysphagia refers to a medical condition where swallowing is difficult or painful. Question 2. Which term describes the swelling of body tissues with water? Option A. Dehydration. Option B. Regurgitation. Option C. Dysphagia. Option D. Edema. The correct answer is option D. Edema. Explanation. Edema is the medical term for fluid retention that causes swelling in body tissues. Question 3. Regurgitation is best defined as which of the following? Option A. The process of breathing out. Option B. The forward flow of blood through the heart. Option C. The backward flow of stomach contents into the mouth. Option D. The movement of fluid into the lungs. The correct answer is option C. The backward flow of stomach contents into the mouth. Explanation. Regurgitation occurs when food or stomach acid travels back up the esophagus into the mouth. Question 4. Which nutrient provides the body with its primary source of energy and fiber? Option A. Proteins. Option B. Fats. Option C. Carbohydrates. Option D. Vitamins. The correct answer is option C. Carbohydrates. Explanation. Carbohydrates are the main energy source for the body and provide necessary dietary fiber. Question 5. Which nutrient is primarily responsible for providing a concentrated source of energy? Option A. Fats. Option B. Minerals. Option C. Proteins. Option D. Water. The correct answer is option A. Fats. Explanation. Fats provide a dense source of energy and help the body absorb certain vitamins. Question 6. Which nutrient is essential for tissue growth and repair? Option A. Carbohydrates. Option B. Fats. Option C. Protein. Option D. Fiber. The correct answer is option C. Protein. Explanation. Proteins are the building blocks of the body and are necessary for maintaining and repairing tissues. Question 7. A clear liquid diet includes foods that are at body temperature and do what? Option A. Leave large amounts of residue. Option B. Are thick and creamy. Option C. Leave small amounts of residue and are usually transparent. Option D. Consist only of pureed meats. The correct answer is option C. Leave small amounts of residue and are usually transparent. Explanation. Clear liquid diets consist of transparent fluids that are easy to digest and leave minimal residue. Question 8. A full liquid diet consists of which of the following? Option A. Only water and clear broth. Option B. Foods that are liquid at room temperature or melt at body temperature. Option C. Solid foods that have been blended. Option D. High-fiber grains and vegetables. The correct answer is option B. Foods that are liquid at room temperature or melt at body temperature. Explanation. Full liquid diets include clear liquids plus items like milk, puddings, and strained soups. Question 9. Which statement best describes a pureed diet? Option A, foods that are served raw. Option B, foods that have a baby food consistency. Option C, foods that are high in spices and flavor. Option D, foods that consist only of clear liquids. The correct answer is option B, foods that have a baby food consistency. Explanation: pureed diets are for residents with chewing or swallowing issues and consist of smooth, blended foods. Question 10. A mechanical soft diet is designed for which of the following? Option A, residents who are nothing by mouth. Option B, residents who require high-calorie snacks. Option C, residents who need semi-solid foods that are easily digested. Option D, residents who can only consume clear liquids. The correct answer is option C, residents who need semi-solid foods that are easily digested. Explanation: mechanical soft diets feature foods that are easy to chew and swallow, such as ground meats. Question 11. A bland diet is characterized by which of the following? Option A, foods that are very spicy. Option B, foods that are served at very hot temperatures. Option C, foods that are non-irritating and served at moderate temperatures. Option D, foods that are high in fiber and seeds. The correct answer is option C, foods that are non-irritating and served at moderate temperatures. Explanation: bland diets avoid irritants like caffeine, spices, and high fiber to soothe the digestive tract. Question 12. When feeding a resident, how full should the spoon be? Option A, 1/3 full. Option B, half full. Option C, completely full. Option D, 2/3 full. The correct answer is option A, 1/3 full. Explanation: small portions on the spoon prevent choking and allow the resident to chew effectively. Question 13. What is a nasogastric tube? Option A, a tube placed through the abdomen into the stomach. Option B, a tube used to provide oxygen through the nose. Option C, a feeding tube inserted through the nose into the stomach. Option D, a tube used to drain urine from the bladder. The correct answer is option C, a feeding tube inserted through the nose into the stomach. Explanation: nasogastric tubes are used for short-term enteral nutrition through the nasal passage. Question 14. What is a gastrostomy tube? Option A, a tube inserted through the nose. Option B, a feeding tube inserted through a surgical opening in the stomach. Option C, a tube used for intravenous fluids. Option D, a tube used to monitor heart rate. The correct answer is option B, a feeding tube inserted through a surgical opening in the stomach. Explanation: gastrostomy tubes are used for long-term feeding through an opening in the abdominal wall. Question 15. In terms of thickened liquids, which is true about honey and nectar consistencies? Option A, honey is thinner than nectar. Option B, nectar is thicker than honey. Option C, honey is thicker and nectar is thinner. Option D, they are the same thickness. The correct answer is option C, honey is thicker and nectar is thinner. Explanation: liquid consistencies are graded to help prevent aspiration. Honey is thicker than nectar. Question 16. What is the average normal oral temperature for an adult? Option A, 97.6 degrees Fahrenheit. Option B, 98.6 degrees Fahrenheit. Option C, 99.6 degrees Fahrenheit. Option D, 96.6 degrees Fahrenheit. The correct answer is option B, 98.6 degrees Fahrenheit. Explanation: the standard average temperature taken by mouth is 98.6 degrees. Question 17. What is the average normal rectal temperature for an adult? Option A, 98.6 degrees Fahrenheit. Option B, 97.6 degrees Fahrenheit. Option C, 99.6 degrees Fahrenheit. Option D, 100.6 degrees Fahrenheit. The correct answer is option C, 99.6 degrees Fahrenheit. Explanation. Rectal temperatures are generally 1 degree higher than oral temperatures. Question 18. What is the average normal axillary temperature for an adult? Option A, 98.6 degrees Fahrenheit. Option B, 97.6 degrees Fahrenheit. Option C, 99.6 degrees Fahrenheit. Option D, 96.6 degrees Fahrenheit. The correct answer is option B, 97.6 degrees Fahrenheit. Explanation. Axillary temperatures are generally 1 degree lower than oral temperatures. Question 19. What is the average normal tympanic temperature for an adult? Option A, 98.6 degrees Fahrenheit. Option B, 99.6 degrees Fahrenheit. Option C, 97.6 degrees Fahrenheit. Option D, 96.6 degrees Fahrenheit. The correct answer is option A, 98.6 degrees Fahrenheit. Explanation. Tympanic or ear temperatures are usually the same as oral temperatures. Question 20. What is the average normal temporal temperature for an adult? Option A, 98.6 degrees Fahrenheit. Option B, 97.6 degrees Fahrenheit. Option C, 99.6 degrees Fahrenheit. Option D, 96.6 degrees Fahrenheit. The correct answer is option C, 99.6 degrees Fahrenheit. Explanation. Temporal or forehead scans are generally similar to rectal temperatures. Question 21. What color is the tip of a rectal thermometer? Option A, blue. Option B, green. Option C, red. Option D, yellow. The correct answer is option C, red. Explanation. Red coating is the universal standard to identify rectal thermometers to prevent cross-contamination. Question 22. What color is the tip of an oral thermometer? Option A, red. Option B, blue. Option C, green. Option D, white. The correct answer is option B, blue. Explanation. Blue coating identifies thermometers intended for oral or axillary use. Question 23. How long should a digital or electronic rectal thermometer stay in place? Option A, until the instrument beeps. Option B, 5 minutes. Option C, 10 minutes. Option D, 2 minutes. The correct answer is option A, until the instrument beeps. Explanation. Modern electronic thermometers signal with a beep when the maximum temperature is reached. Question 24. When should you avoid taking a rectal temperature because it might stimulate the vagus nerve? Option A, if the resident has a headache. Option B, if the resident has a heart condition. Option C, if the resident has a broken leg. Option D, if the resident is hungry. The correct answer is option B, if the resident has a heart condition. Explanation. Vagal stimulation can cause a dangerous drop in heart rate in residents with cardiac issues. Question 25. What is the normal pulse rate range for a healthy adult? Option A, 40 to 60 beats per minute. Option B, 100 to 140 beats per minute. Option C, 60 to 100 beats per minute. Option D, 80 to 120 beats per minute. The correct answer is option C, 60 to 100 beats per minute. Explanation. A resting heart rate between 60 and 100 is considered normal for an adult. Question 26. How long should you count a radial pulse if the rhythm is regular? Option A, 15 seconds. Option B, 30 seconds. Option C, 60 seconds. Option D, 10 seconds. The correct answer is option B, 30 seconds. Explanation. Multiplying a 30-second count by 2 is an efficient way to get the heart rate if it is regular. Question 27. How long must you count a radial pulse if it is irregular? Option A, 30 seconds. Option B, 45 seconds. Option C, 60 seconds. Option D, 2 minutes. The correct answer is option C, 60 seconds. Explanation. A full minute is required to accurately assess the rate and rhythm of an irregular pulse. Question 28. How long should you count an apical pulse using a stethoscope? Option A, 30 seconds. Option B, 45 seconds. Option C, 60 seconds. Option D, 10 seconds. The correct answer is option C, 60 seconds. Explanation. Apical pulses must always be counted for 1 full minute for clinical accuracy. Question 29. What is the normal respiration range for a healthy adult? Option A, 8 to 12 breaths per minute. Option B, 20 to 30 breaths per minute. Option C, 12 to 20 breaths per minute. Option D, 15 to 25 breaths per minute. The correct answer is option C, 12 to 20 breaths per minute. Explanation. Adults typically breathe between 12 and 20 times per minute at rest. Question 30. How long should you count respirations for the most accurate result? Option A, 15 seconds. Option B, 30 seconds. Option C, 60 seconds. Option D, 10 seconds. The correct answer is option C, 60 seconds. Explanation. Counting for a full minute allows the nursing assistant to observe the rhythm and depth of breathing. Question 31. What is the normal range for systolic blood pressure in an adult? Option A, 60 to 80. Option B, 140 to 160. Option C, 90 to 120. Option D, 100 to 130. The correct answer is option C, 90 to 120. Explanation. The systolic pressure, or top number, is normal when it is between 90 and 120. Question 32. What is the normal range for diastolic blood pressure in an adult? Option A, 90 to 120. Option B, 60 to 80. Option C, 40 to 60. Option D, 80 to 100. The correct answer is option B, 60 to 80. Explanation. The diastolic pressure, or bottom number, is normal when it is between 60 and 80. Question 33. What is another name for a blood pressure cuff? Option A, stethoscope. Option B, thermometer. Option C, sphygmomanometer. Option D, pulse oximeter. The correct answer is option C, sphygmomanometer. Explanation. The sphygmomanometer is the formal medical name for the blood pressure cuff. Question 34. When is the best time to weigh a resident to ensure accuracy? Option A, in the evening after dinner. Option B, in the morning before breakfast after voiding. Option C, directly after a large snack. Option D, in the middle of the afternoon. The correct answer is option B, in the morning before breakfast after voiding. Explanation. Weight is most stable in the morning after the bladder is emptied and before food intake. Question 35. How many inches are in 4 feet? Option A, 40 inches. Option B, 48 inches. Option C, 52 inches. Option D, 60 inches. The correct answer is option B, 48 inches. Explanation. There are 12 inches per foot, so 4 feet equals 48 inches. Question 36. How many inches are in 5 feet? Option A, 50 inches. Option B, 60 inches. Option C, 70 inches. Option D, 80 inches. The correct answer is option B, 60 inches. Explanation. Multiplying 5 feet by 12 inches equals 60 inches. Question 37. How many inches are in 6 feet? Option A, 66 inches. Option B, 72 inches. Option C, 78 inches. Option D, 84 inches. The correct answer is option B, 72 inches. Explanation. Multiplying 6 feet by 12 inches equals 72 inches. Question 38. Which of the following describes a skin tear? Option A, a deep bruise under the skin. Option B, a break or rip in the outer layer of the skin. Option C, a purple spot caused by aging. Option D, a large wart. The correct answer is option B, a break or rip in the outer layer of the skin. Explanation. Skin tears are common in the elderly due to thin, fragile skin and can be caused by friction. Question 39. Where are venous ulcers commonly found? Option A, on the face and neck. Option B, on the lower legs or feet, such as the heels or inner ankles. Option C, on the palms of the hands. Option D, on the stomach and chest. The correct answer is option B, on the lower legs or feet, such as the heels or inner ankles. Explanation. Venous ulcers are caused by poor blood return and often appear on the lower extremities. Question 40. Arterial ulcers are typically caused by which of the following? Option A, excessive moisture on the skin. Option B, poor blood flow from the heart to the extremities. Option C, lying in one position for too long. Option D, a bacterial infection in the blood. The correct answer is option B, poor blood flow from the heart to the extremities. Explanation. Blocked or narrowed arteries prevent oxygen from reaching the tissues, leading to ulcers. Question 41. Where is the most common location for a decubitus or pressure ulcer to develop? Option A, the nose. Option B, the palms. Option C, the sacrum or tailbone. Option D, the shins. The correct answer is option C, the sacrum or tailbone. Explanation. The sacrum is a major bony prominence that often bears the weight of the body in bed. Question 42. What happens to the tissues when gangrene occurs? Option A, they turn bright red and itchy. Option B, the tissues become black and die. Option C, they become very soft and moist. Option D, they grow extra layers of skin. The correct answer is option B. The tissues become black and die. Explanation. Gangrene is tissue death caused by a lack of blood flow or a serious bacterial infection. Question 43. When is the best time to put on anti-embolism stockings? Option A, in the evening before bed. Option B, after the resident has walked for an hour. Option C, in the morning before they get out of bed. Option D, directly after a shower. The correct answer is option C, in the morning before they get out of bed. Explanation. Applying stockings before the resident stands prevents blood from pooling and causing leg swelling. Question 44. What is a hot soak? Option A. Taking a hot bath in a tub. Option B. Placing a body part into warm water. Option C. Applying a wet towel to the face. Option D. Sitting in a steam room. The correct answer is option B. Placing a body part into warm water. Explanation. A hot soak involves immersing a specific body part, like a hand or foot, in warm water. Question 45. What is a sitz bath? Option A. A bath where the entire body is submerged. Option B. A bath where the perineal and rectal area are immersed in warm water. Option C. A bath used only for infants. Option D. A dry heat application using a heat lamp. The correct answer is option B. A bath where the perineal and rectal area are immersed in warm water. Explanation. Sitz baths are used to soothe and heal the perineal area after surgery or childbirth. Question 46. What is a bony prominence? Option A. An area where the bone sticks out through the skin. Option B. An area where bone lies close to the skin surface. Option C. A type of bone cancer. Option D. A broken bone that has healed. The correct answer is option B. An area where bone lies close to the skin surface. Explanation. Bony prominences like heels and hips are high-risk areas for pressure injuries. Question 47. In terms of skin health, what is friction? Option A. The layers of skin rubbing against each other. Option B. The rubbing of one thing against another. Option C. A bacterial infection of the skin. Option D. The process of skin healing. The correct answer is option B. The rubbing of one thing against another. Explanation. Friction occurs when skin drags across a surface like a bed sheet, causing damage. Question 48. What is skin shearing? Option A. Cutting the hair on the skin. Option B. When layers of skin rub against each other. Option C. The process of a wound closing. Option D. A type of skin rash. The correct answer is option B. When layers of skin rub against each other. Explanation. Shearing occurs when the skin stays in place while the underlying bone and tissue move. Question 49. What is eschar? Option A. A type of clear fluid from a wound. Option B. Black, dead tissue found in a wound. Option C. A surgical drain. Option D. New skin growth. The correct answer is option B. Black, dead tissue found in a wound. Explanation. Eschar is thick, leathery, dead tissue that often covers deep pressure ulcers. Question 50. What is slough? Option A. New muscle tissue. Option B. Yellow or white stringy tissue in a wound. Option C. A type of cleaning solution. Option D. A medicated bandage. The correct answer is option B. Yellow or white stringy tissue in a wound. Explanation. Slough is dead tissue that must be removed for a wound to heal properly. Question 51. What is a pressure ulcer? Option A. A rash caused by an allergy. Option B. Injury to the skin and underlying tissue caused by constant pressure. Option C. A bruise from a fall. Option D. A cut from a sharp object. The correct answer is option B. Injury to the skin and underlying tissue caused by constant pressure. Explanation. Pressure ulcers are also known as bed sores and are preventable with proper care. Question 52. How often should a person's position be changed when they are sitting in a chair? Option A. Every hour. Option B. Every 2 hours. Option C. Every 15 minutes. Option D, once a day. The correct answer is option C, every 15 minutes. Explanation. Frequent shifts are needed because sitting puts high pressure on small areas like the tailbone. Question 53. What is a prosthesis? Option A, a type of hearing aid. Option B, an artificial limb or replacement part for the body. Option C, a special type of wheelchair. Option D, a medical diagnosis. The correct answer is option B, an artificial limb or replacement part for the body. Explanation. Prosthetics include items like artificial legs, arms, and glass eyes. Question 54. What is the definition of rehabilitation? Option A, the process of a resident getting older. Option B, restoring a disabled person to the highest level of functioning possible. Option C, providing comfort care only. Option D, moving a resident to a different facility. The correct answer is option B, restoring a disabled person to the highest level of functioning possible. Explanation. Rehabilitation involves therapies designed to regain lost skills and independence. Question 55. What is a restorative aid? Option A, a specialized type of walker. Option B, a nursing assistant with special training in restorative nursing and rehab. Option C, a medication that restores memory. Option D, a device used to help a resident breathe. The correct answer is option B, a nursing assistant with special training in restorative nursing and rehab. Explanation. Restorative aids assist residents with exercises and functional training. Question 56. Restorative nursing care is best described as which of the following? Option A, care that focuses only on the resident's spiritual needs. Option B, care that helps people regain health, strength, and independence. Option C, care that is only provided in a hospital. Option D, care that involves performing surgeries. The correct answer is option B, care that helps people regain health, strength, and independence. Explanation. Restorative nursing maintains the gains made during formal rehabilitation. Question 57. What is the clinical definition of anxiety? Option A, a sudden loss of memory. Option B, an uneasy feeling in response to stress. Option C, the belief that you are a famous person. Option D, a physical injury to the brain. The correct answer is option B, an uneasy feeling in response to stress. Explanation. Anxiety is a common mental health response to change, illness, or stress. Question 58. What is a compulsion? Option A, a recurrent unwanted thought. Option B, repeating an act more than once or multiple times. Option C, the belief that someone is following you. Option D, a sudden feeling of intense fear. The correct answer is option B, repeating an act more than once or multiple times. Explanation. Compulsions are ritualistic behaviors a person feels driven to perform. Question 59. What is a delusion of grandeur? Option A, the fear of being in small spaces. Option B, the reliving of a trauma. Option C, an exaggerated belief about one's own importance, wealth, or power. Option D, the loss of the ability to speak. The correct answer is option C, an exaggerated belief about one's own importance, wealth, or power. Explanation. Delusions of grandeur are false beliefs where a person thinks they are famous or powerful. Question 60. What is a flashback? Option A, a sudden loss of consciousness. Option B, reliving a trauma throughout the day or while sleeping. Option C, a type of bright light used in therapy. Option D, a temporary improvement in memory. The correct answer is option B, reliving a trauma throughout the day or while sleeping. Explanation: flashbacks are common in post-traumatic stress disorder. Question 61. What is a hallucination? Option A, a false belief about a situation. Option B, seeing, hearing, smelling, or feeling unreal things. Option C, the inability to move a limb. Option D, a loss of appetite. The correct answer is option B, seeing, hearing, smelling, or feeling unreal things. Explanation: hallucinations are sensory experiences that occur without an external stimulus. Question 62. What is an obsession? Option A, a ritualistic behavior. Option B, a recurrent, unwanted thought, idea, or image. Option C, an intense fear of a specific object. Option D, a state of severe confusion. The correct answer is option B, a recurrent, unwanted thought, idea, or image. Explanation: obsessions are intrusive thoughts that cause significant anxiety. Question 63. What is panic? Option A, an intense and sudden feeling of fear, anxiety, or terror. Option B, a long-term state of sadness. Option C, a type of physical exercise. Option D, a normal response to a joke. The correct answer is option A, an intense and sudden feeling of fear, anxiety, or terror. Explanation: panic attacks involve overwhelming physical and emotional distress. Question 64. What is paranoia? Option A, a state of extreme happiness. Option B, false beliefs and suspicion about a person or situation. Option C, the loss of hearing. Option D, a type of skin infection. The correct answer is option B, false beliefs and suspicion about a person or situation. Explanation: paranoid individuals may believe others are trying to harm or plot against them. Question 65. What is a phobia? Option A, an intense fear of a specific object or situation. Option B, a loss of the sense of taste. Option C, a type of medication used for sleep. Option D, a state of total memory loss. The correct answer is option A, an intense fear of a specific object or situation. Explanation: phobias are irrational and excessive fears that interfere with daily life. Question 66. What is suicide contagion? Option A, a disease that causes suicidal thoughts. Option B, exposure to suicide or suicidal behaviors within a group of people. Option C, a type of biological weapon. Option D, the fear of death. The correct answer is option B, exposure to suicide or suicidal behaviors within a group of people. Explanation: contagion refers to the increased risk of suicide after exposure to others' suicides. Question 67. What is withdrawal syndrome? Option A, a type of physical exercise for the legs. Option B, a physical and medical response after stopping a regularly used substance. Option C, the process of moving a resident to a new room. Option D, a symptom of a common cold. The correct answer is option B, a physical and medical response after stopping a regularly used substance. Explanation: withdrawal occurs when the body reacts to the absence of a drug or alcohol it has become dependent on. Question 68. What does the abbreviation BPD stand for in mental health? Option A, bipolar personality disease. Option B, borderline personality disorder. Option C, basic psychological development. Option D, brief panic disorder. The correct answer is option B. Borderline personality disorder. Explanation. Borderline personality disorder affects how a person feels about themselves and others. Question 69. What does the abbreviation PTSD stand for? Option A. Physical therapy and social development. Option B. Post-traumatic stress disorder. Option C. Permanent tissue and skin damage. Option D. Partial temporal seizure disorder. The correct answer is option B. Post-traumatic stress disorder. Explanation. Post-traumatic stress disorder is a mental health condition triggered by a terrifying event. Question 70. What does the abbreviation OCD stand for? Option A. Overactive cardiac drive. Option B. Obsessive-compulsive disorder. Option C. Oral care and dental hygiene. Option D. Orthopedic clinical diagnosis. The correct answer is option B. Obsessive-compulsive disorder. Explanation. Obsessive-compulsive disorder involves patterns of unwanted thoughts and repetitive behaviors. Question 71. How is schizophrenia best defined? Option A. A loss of memory due to aging. Option B. A split mind or a brain disorder that affects how a person thinks and behaves. Option C. A temporary state of confusion. Option D. A type of physical paralysis. The correct answer is option B. A split mind or a brain disorder that affects how a person thinks and behaves. Explanation. Schizophrenia is a chronic and severe mental disorder involving distorted reality. Question 72. In terms of mental health, what does mania refer to? Option A. A state of deep depression. Option B. Emotional highs and extreme energy or agitation. Option C. A fear of being alone. Option D. The inability to sleep. The correct answer is option B. Emotional highs and extreme energy or agitation. Explanation. Mania is often a phase of bipolar disorder characterized by euphoria and hyperactivity. Question 73. True or false alcoholism can be fully cured with the right medication? Option A. True. Option B. False. Option C. Null. Option D. Null. The correct answer is option B. False. Explanation. Alcoholism is considered a chronic disease that can be managed but not cured. Question 74. What is the clinical definition of cognitive function? Option A. The ability of the body to move. Option B. Memory, thinking, reasoning, and the ability to understand. Option C. The process of digestion. Option D. The function of the heart and lungs. The correct answer is option B. Memory, thinking, reasoning, and the ability to understand. Explanation. Cognitive function relates to the brain's ability to process and retain information. Question 75. What is confusion? Option A. A state of extreme physical fitness. Option B. A mental state of being disoriented to person, time, place, or identity. Option C. The loss of the ability to walk. Option D. A normal part of the aging process. The correct answer is option B. A mental state of being disoriented to person, time, place, or identity. Explanation. Confusion can be temporary or permanent and affects a person's orientation. Question 76. What is delirium? Option A. A slow and gradual decline in memory. Option B. A state of sudden, severe confusion and rapid changes in brain function. Option C. A type of physical seizure. Option D. A state of deep sleep. The correct answer is option B. A state of sudden, severe confusion and rapid changes in brain function. Explanation. Delirium is often temporary and can be caused by infection or medication reactions. Question 77. What is dementia? Option A, a normal loss of memory that happens to everyone. Option B, the loss of cognitive function that interferes with routine activities. Option C, a temporary state of agitation at night. Option D, a physical injury to the spine. The correct answer is option B, the loss of cognitive function that interferes with routine activities. Explanation. Dementia is a group of symptoms caused by various brain diseases, including Alzheimer's. Question 78. What is sundowning? Option A, when a resident feels better in the morning. Option B, the process of the sun setting. Option C, when signs and behaviors of Alzheimer's increase during hours of darkness. Option D, a type of skin rash caused by the sun. The correct answer is option C, when signs and behaviors of Alzheimer's increase during hours of darkness. Explanation. Sundowning involves increased confusion and agitation in the late afternoon and evening. Question 79. What is fainting? Option A, a sudden loss of memory. Option B, a sudden loss of consciousness from a lack of blood supply to the brain. Option C, a type of physical exercise. Option D, a normal way to fall asleep. The correct answer is option B, a sudden loss of consciousness from a lack of blood supply to the brain. Explanation. Fainting is often preceded by dizziness, sweating, or blurred vision. Question 80. What is a hemorrhage? Option A, a type of severe headache. Option B, the excessive loss of blood in a short period of time. Option C, a blockage in the digestive tract. Option D, a type of skin ulcer. The correct answer is option B, the excessive loss of blood in a short period of time. Explanation. Hemorrhaging is a medical emergency that requires immediate pressure and intervention. Question 81. What is respiratory arrest? Option A, when the heart stops beating. Option B, when breathing stops but the heart continues to beat for a few minutes. Option C, a type of severe cough. Option D, the loss of the sense of smell. The correct answer is option B, when breathing stops but the heart continues to beat for a few minutes. Explanation. Respiratory arrest requires immediate rescue breathing to prevent cardiac arrest. Question 82. What is a seizure? Option A, a sudden loss of the ability to speak. Option B, violent and sudden contractions or tremors of muscle groups. Option C, a type of severe muscle cramp. Option D, a state of deep depression. The correct answer is option B, violent and sudden contractions or tremors of muscle groups. Explanation. Seizures are caused by abnormal electrical activity in the brain. Question 83. In an emergency, what is shock? Option A, a state of being surprised. Option B, when organs and tissues do not get enough blood. Option C, a type of electrical injury. Option D, a sudden loud noise. The correct answer is option B, when organs and tissues do not get enough blood. Explanation. Shock is a life-threatening condition that requires immediate medical treatment. Question 84. What is sudden cardiac arrest? Option A, when the heart stops suddenly and without warning. Option B, a slow decline in heart function over years. Option C, a type of chest pain. Option D, when a person stops breathing but their heart continues. The correct answer is option A, when the heart stops suddenly and without warning. Explanation. Sudden cardiac arrest results in immediate loss of consciousness and requires cardiopulmonary resuscitation. Question 85. What does the abbreviation AED stand for? Option A, Advanced Emergency Device. Option B, Automated External Defibrillator. Option C, Aged and Elderly Department. Option D, Airway and Esophagus Drain. The correct answer is option B, Automated External Defibrillator. Explanation. An automated external defibrillator is used to deliver a shock to the heart during cardiac arrest. Question 86. What does the abbreviation BLS stand for? Option A, Basic Life Support. Option B, Blood Level Survey. Option C, Breathing and Lung Safety. Option D, Body Language Study. The correct answer is option A, Basic Life Support. Explanation. Basic life support includes procedures like cardiopulmonary resuscitation and choking relief. Question 87. What does RRT stand for in a hospital or facility? Option A, Resident Recovery Team. Option B, Rapid Response Team. Option C, Radiology and Radiation Therapy. Option D, Routine Recording Task. The correct answer is option B, Rapid Response Team. Explanation. A rapid response team is called when a resident shows signs of severe clinical decline. Question 88. What is the ratio of chest compressions to rescue breaths during adult cardiopulmonary resuscitation? Option A, 15 compressions to 2 breaths. Option B, 30 compressions to 2 breaths. Option C, 10 compressions to 1 breath. Option D, 50 compressions to 5 breaths. The correct answer is option B, 30 compressions to 2 breaths. Explanation. The standard ratio for adult CPR is 30 compressions followed by 2 breaths. Question 89. What is a thrombus? Option A, a blood clot that has broken off and is traveling. Option B, a blood clot that is still attached to the wall of a vessel. Option C, a type of muscle tumor. Option D, a blockage in the airway. The correct answer is option B, a blood clot that is still attached to the wall of a vessel. Explanation. A thrombus can block blood flow and lead to serious conditions like a heart attack. Question 90. What is an embolus? Option A, a blood clot that stays in one place. Option B, a blood clot or object that has broken off and is traveling through the blood. Option C, a type of severe skin rash. Option D, a sudden loss of memory. The correct answer is option B, a blood clot or object that has broken off and is traveling through the blood. Explanation. An embolus can travel to the lungs or brain, causing life-threatening complications. Question 91. What is anaphylactic shock? Option A, a type of shock caused by blood loss. Option B, a severe and life-threatening allergic reaction. Option C, a state of confusion caused by a stroke. Option D, the response of the body to extreme cold. The correct answer is option B, a severe and life-threatening allergic reaction. Explanation. Anaphylaxis causes swelling of the airway and requires immediate medication. Question 92. What is a cerebrovascular accident? Option A, a serious car accident. Option B, the medical term for a stroke. Option C, a broken bone in the spine. Option D, a type of heart attack. The correct answer is option B, the medical term for a stroke. Explanation. A cerebrovascular accident occurs when blood flow to the brain is interrupted. Question 93. What is a partial seizure? Option A, a seizure where the person loses total consciousness. Option B, a seizure where only one part of the brain is involved and consciousness is maintained. Option C, a seizure that lasts for only 1 second. Option D, a seizure that only affects the legs. The correct answer is option B, a seizure where only one part of the brain is involved and consciousness is maintained. Explanation. During a partial seizure, the person may experience sensory changes or involuntary movements. Question 94. What is a tonic-clonic or grand mal seizure? Option A, a seizure where the person remains fully awake. Option B, a seizure involving loss of consciousness and violent muscle contractions. Option C, a seizure that only involves the eyes. Option D, a seizure caused by low blood sugar. The correct answer is option B, a seizure involving loss of consciousness and violent muscle contractions. Explanation. Tonic-clonic seizures are the most common type of generalized seizure. Question 95. What are advance directives? Option A, instructions on how to perform a surgery. Option B, documents stating a person's wishes about health care when they cannot make decisions. Option C, the rules and regulations of the facility. Option D, a type of medication used for pain. The correct answer is option B, documents stating a person's wishes about health care when they cannot make decisions. Explanation. Advance directives include living wills and durable powers of attorney for healthcare. Question 96. What is the goal of palliative care? Option A, to perform aggressive surgeries to find a cure. Option B, to relieve or reduce the intensity of uncomfortable symptoms without a cure. Option C, to provide physical therapy for a full recovery. Option D, to help a resident move to a new home. The correct answer is option B, to relieve or reduce the intensity of uncomfortable symptoms without a cure. Explanation. Palliative care focuses on quality of life and comfort for those with serious illnesses. Question 97. What is post-mortem care? Option A, care given to a resident right before they die. Option B, care of the body after death. Option C, the process of reading a person's will. Option D, a type of spiritual counseling. The correct answer is option B, care of the body after death. Explanation. Post-mortem care involves cleaning and positioning the body with respect. Question 98. What is reincarnation? Option A, the belief that a person only lives once. Option B, the belief that the spirit or soul is reborn in another form of life. Option C, a type of medical treatment for the elderly. Option D, the process of a body decaying. The correct answer is option B, the belief that the spirit or soul is reborn in another form of life. Explanation. Religious and cultural beliefs about reincarnation can affect how a family views death. Question 99. What is rigor mortis? Option A, a state of deep sleep after death. Option B, the stiffness of skeletal muscles that occurs after death. Option C, a type of infection that causes skin to rot. Option D, the process of the heart stopping. The correct answer is option B, the stiffness of skeletal muscles that occurs after death. Explanation. Rigor mortis makes the body difficult to move and typically begins a few hours after death. Question 100. Which statement best describes hospice care? Option A, care that is focused on curing a terminal illness. Option B, care for dying persons and their families that focuses on comfort and dignity. Option C, care that is only provided in a hospital intensive care unit. Option D, a program designed to help residents return to work. The correct answer is option B, care for dying persons and their families that focuses on comfort and dignity. Explanation: hospice care is typically for those with 6 months or less to live. Question 101. In the stages of dying, what is the denial stage? Option A, the person is calm and at peace. Option B, the person refuses to believe that he or she is dying. Option C, the person asks why me and is very upset. Option D, the person makes promises to God for more time. The correct answer is option B. The person refuses to believe that he or she is dying. Explanation: denial is a common initial defense mechanism when facing a terminal diagnosis. Question 102. In the stages of dying, what is the anger stage? Option A, the person is sad and withdrawn. Option B, the person asks why me and may be difficult to care for. Option C, the person accepts that death is near. Option D, the person refuses to talk to anyone. The correct answer is option B. The person asks why me and may be difficult to care for. Explanation: anger is a normal response to the loss of control and the end of life. Question 103. In the stages of dying, what is the bargaining stage? Option A, the person is very depressed. Option B, the person tries to make deals with a higher power for more time. Option C, the person is happy and relieved. Option D, the person avoids all medical treatment. The correct answer is option B. The person tries to make deals with a higher power for more time. Explanation: bargaining often involves the hope of reaching a specific milestone or event. Question 104. In the stages of dying, what is the depression stage? Option A, the person is angry at the staff. Option B, the person becomes very sad and may withdraw from others. Option C, the person is in a state of shock. Option D, the person is ready to die. The correct answer is option B. The person becomes very sad and may withdraw from others. Explanation: depression is a natural part of the grieving process as the person realizes death is inevitable. Question 105. In the stages of dying, what is the acceptance stage? Option A, the person is in denial about their health. Option B, the person is calm and at peace with the end of life. Option C, the person is still trying to find a cure. Option D, the person is very fearful of the future. The correct answer is option B. The person is calm and at peace with the end of life. Explanation: acceptance is often the final stage before death occurs. Question 106. Which sense is generally thought to be the last function to leave the body at death? Option A, sight. Option B, taste. Option C, hearing. Option D, smell. The correct answer is option C, hearing. Explanation: it is important to continue talking to and comforting a dying resident as they may still hear you. Question 107. What typically happens to the body's circulation as death approaches? Option A, circulation improves and skin becomes warm. Option B, circulation fails and the skin becomes cool, pale, and blotchy. Option C, the heart rate increases significantly. Option D, the blood pressure becomes very high. The correct answer is option B. Circulation fails and the skin becomes cool, pale, and blotchy. Explanation: Mottling and cold extremities are clinical signs that the body's systems are shutting down. Question 108. In blood pressure, what is the diastolic reading? Option A, the top number. Option B, the bottom number. Option C, the average of 3 readings. Option D, the pulse rate. The correct answer is option B, the bottom number. Explanation. The diastolic pressure represents the pressure in the arteries when the heart is at rest. Question 109. In blood pressure, what is the systolic reading? Option A, the bottom number. Option B, the pulse rate. Option C, the top number. Option D, the temperature. The correct answer is option C, the top number. Explanation. The systolic pressure represents the pressure in the arteries when the heart is contracting. Question 110. What is the clinical definition of hypotension? Option A, high blood pressure. Option B, normal blood pressure. Option C, low blood pressure. Option D, rapid heart rate. The correct answer is option C, low blood pressure. Explanation. Hypotension can cause dizziness and fainting and may require medical attention. Question 111. What is the clinical definition of hypotension? Option A, low blood pressure. Option B, high blood pressure. Option C, slow heart rate. Option D, high body temperature. The correct answer is option B, high blood pressure. Explanation. Chronic hypertension is a major risk factor for heart disease and stroke. Question 112. What is inhalation? Option A, breathing out. Option B, holding your breath. Option C, breathing in. Option D, a type of severe cough. The correct answer is option C, breathing in. Explanation. Inhalation brings oxygen into the lungs to be distributed to the body. Question 113. What is exhalation? Option A, breathing in. Option B, breathing out. Option C, a sudden loss of breath. Option D, a type of medical equipment. The correct answer is option B, breathing out. Explanation. Exhalation removes carbon dioxide from the body. Question 114. Where is an axillary temperature taken? Option A, in the mouth. Option B, in the ear. Option C, under the arm. Option D, on the forehead. The correct answer is option C, under the arm. Explanation. The axilla is the medical term for the armpit. Question 115. Where is a tympanic temperature taken? Option A, in the rectum. Option B, in the ear. Option C, on the wrist. Option D, under the tongue. The correct answer is option B, in the ear. Explanation. Tympanic thermometers measure the heat from the eardrum. Question 116. Where is a temporal temperature taken? Option A, scanning the forehead. Option B, inside the mouth. Option C, under the arm. Option D, on the chest. The correct answer is option A, scanning the forehead. Explanation. Temporal artery thermometers are non-invasive and quick. Question 117. Where is a rectal temperature taken? Option A, in the ear. Option B, in the mouth. Option C, in the rectum. Option D, under the arm. The correct answer is option C, in the rectum. Explanation. Rectal temperatures are accurate but must be done with great care. Question 118. Where is an oral temperature taken? Option A, in the rectum. Option B, in the mouth. Option C, in the ear. Option D, on the forehead. The correct answer is option B, in the mouth. Explanation. Oral is the most common site for taking a temperature in conscious adults. Question 119. Where is the carotid pulse located? Option A, at the wrist. Option B, in the neck. Option C, over the heart. Option D, at the groin. The correct answer is option B, in the neck. Explanation. The carotid pulse is used during emergency situations like cardiopulmonary resuscitation. Question 120. Where is the apical pulse taken? Option A, at the wrist. Option B, over the heart with a stethoscope. Option C, inside the elbow. Option D, behind the knee. The correct answer is option B, over the heart with a stethoscope. Explanation. The apical pulse is the most accurate measurement of the actual heart rate. Question 121. Where is the brachial pulse located? Option A, at the wrist. Option B, on the inside of the elbow. Option C, in the neck. Option D, at the top of the foot. The correct answer is option B, on the inside of the elbow. Explanation. The brachial pulse is commonly used when taking a manual blood pressure. Question 122. Where is the radial pulse located? Option A, in the neck. Option B, at the wrist on the thumb side. Option C, at the groin. Option D, behind the ankle. The correct answer is option B, at the wrist on the thumb side. Explanation. The radial site is the most common place to count a pulse for routine vital signs. Question 123. Where is the femoral pulse located? Option A, behind the knee. Option B, at the groin. Option C, in the neck. Option D, at the wrist. The correct answer is option B, at the groin. Explanation. The femoral artery is a major vessel located in the crease of the leg. Question 124. What is bradypnea? Option A, rapid breathing. Option B, slow breathing. Option C, absence of breathing. Option D, painful breathing. The correct answer is option B, slow breathing. Explanation. Bradypnea involves a respiration rate that is lower than the normal range. Question 125. What is tachypnea? Option A, slow breathing. Option B, rapid breathing. Option C, normal breathing. Option D, difficulty breathing while lying down. The correct answer is option B, rapid breathing. Explanation. Tachypnea is a respiration rate that is higher than 20 breaths per minute. Question 126. What is radiating pain? Option A, pain that stays in one spot. Option B, pain that is felt at the site of tissue damage and in nearby areas. Option C, pain that only lasts for a second. Option D, pain that is caused by heat. The correct answer is option B, pain that is felt at the site of tissue damage and in nearby areas. Explanation. An example of radiating pain is a heart attack where pain moves from the chest to the arm. Question 127. What is phantom pain? Option A, pain caused by a ghost. Option B, pain felt in a body part that is no longer there. Option C, pain that comes and goes. Option D, pain that cannot be explained. The correct answer is option B, pain felt in a body part that is no longer there. Explanation. Phantom pain is real pain felt after an amputation and must be treated. Question 128. What is a microbe? Option A, a large animal. Option B, a small living thing seen only with a microscope. Option C, a type of medical equipment. Option D, a symptom of a cold. The correct answer is option B, a small living thing seen only with a microscope. Explanation. Microbes include bacteria, viruses, and fungi. Question 129. What is the definition of disinfection? Option A, the process of killing all microbes. Option B, the process of destroying pathogens. Option C, washing hands with soap. Option D, applying a bandage. The correct answer is option B, the process of destroying pathogens. Explanation. Disinfection reduces the number of harmful microbes on a surface. Question 130. What is a pathogen? Option A, a microbe that is helpful to the body. Option B, a microbe that is harmful and can cause infection. Option C, a type of cleaning chemical. Option D, a professional healthcare worker. The correct answer is option B, a microbe that is harmful and can cause infection. Explanation. Pathogens are responsible for causing diseases. Question 131. What does the term sterile mean? Option A, the presence of some bacteria. Option B, the absence of all microbes. Option C, being very clean. Option D, free of visible dirt. The correct answer is option B, the absence of all microbes. Explanation. Sterility is required for procedures like surgery or catheter insertion. Question 132. What is asepsis? Option A, a severe infection in the blood. Option B, being free of disease-producing microbes. Option C, the process of a wound healing. Option D, a type of medical diagnosis. The correct answer is option B, being free of disease-producing microbes. Explanation. Asepsis prevents the spread of infection from one person to another. Question 133. What does the abbreviation AN and O stand for? Option A, air and oxygen. Option B, alert and oriented. Option C, active and outgoing. Option D, average and ordinary. The correct answer is option B, alert and oriented. Explanation. This term is used to describe a resident's level of consciousness. Question 134. What does the abbreviation ABD stand for? Option A, advanced body development. Option B, abdomen. Option C, airborne disease. Option D, above bed device. The correct answer is option B, abdomen. Explanation. The abdomen is the part of the body containing the digestive organs. Question 135. What does the abbreviation AC stand for in medical timing? Option A, after meals. Option B, before meals. Option C, at bedtime. Option D, as requested. The correct answer is option B, before meals. Explanation. The abbreviation comes from the Latin anticipum. Question 136. What does a KS stand for in surgery? Option A, above knee amputation. Option B, also known as. Option C, acute kidney ailment. Option D, active knee alignment. The correct answer is option A, above knee amputation. Explanation. This identifies the level at which a limb was removed. Question 137. What does the abbreviation AM stand for? Option A, ambulance. Option B, ambulate or walk. Option C, ambidextrous. Option D, ambient temperature. The correct answer is option B. Ambulate or walk. Explanation. Ambulation is the medical term for walking. Question 138. What does the abbreviation ASAP stand for? Option A, as soon as possible. Option B, as simple as possible. Option C, active safety and protection. Option D, after small amount provided. The correct answer is option A, as soon as possible. Explanation. This indicates that a task should be prioritized. Question 139. What does the abbreviation twice daily stand for? Option A, once a day. Option B, twice a day. Option C, 3 times a day. Option D, every other day. The correct answer is option B, twice a day. Explanation. The abbreviation comes from the Latin bis in die. Question 140. What does the abbreviation BKA stand for? Option A, below knee amputation. Option B, bowel and kidney assessment. Option C, body keen awareness. Option D, basic knee adjustment. The correct answer is option A, below knee amputation. Explanation. This identifies that the amputation occurred below the knee joint. Question 141. What does the abbreviation BM stand for? Option A, blood monitor. Option B, bowel movement. Option C, body mass. Option D, breathing method. The correct answer is option B, bowel movement. Explanation. A bowel movement is the excretion of feces from the body. Question 142. What does the abbreviation BP stand for? Option A, body position. Option B, blood pressure. Option C, breathing pattern. Option D, basic procedure. The correct answer is option B, blood pressure. Explanation. Blood pressure is a key vital sign measured in millimeters of mercury. Question 143. What does the abbreviation BPM stand for? Option A, beats or breaths per minute. Option B, body pressure monitor. Option C, basic patient management. Option D, bed position manual. The correct answer is option A, beats or breaths per minute. Explanation. This unit is used when measuring pulse or respirations. Question 144. What does the abbreviation BRP stand for? Option A, bed rest prescribed. Option B, bathroom privileges. Option C, basic room protocol. Option D, breathing rate pattern. The correct answer is option B, bathroom privileges. Explanation. Bathroom privileges mean the resident is allowed to use the toilet. Question 145. What does the abbreviation COPD stand for? Option A, chronic obstructive pulmonary disease. Option B, cardiac output and pulse drive. Option C, common oral pressure disorder. Option D, central observation and patient data. The correct answer is option A, chronic obstructive pulmonary disease. Explanation. Chronic obstructive pulmonary disease is a long-term lung condition that makes breathing difficult. Question 146. What does the abbreviation DNR stand for? Option A, do not remove. Option B, do not resuscitate. Option C, daily nursing report. Option D, decision not required. The correct answer is option B, do not resuscitate. Explanation. A do not resuscitate order means medical staff will not attempt CPR. Question 147. What does the abbreviation DOA stand for? Option A, date of admission. Option B, dead on arrival. Option C, daily observation area. Option D, dietary order assigned. The correct answer is option B, dead on arrival. Explanation. This term is used when a person is deceased before reaching the facility. Question 148. What does the abbreviation DVT stand for? Option A, deep venous thrombosis. Option B, daily vital trend. Option C, dietary and vitamin therapy. Option D, digital volume target. The correct answer is option A, deep venous thrombosis. Explanation. Deep venous thrombosis is a blood clot in a deep vein, usually in the leg. Question 149. What does the abbreviation GI stand for? Option A, General Infirmary. Option B, Gastrointestinal. Option C, Genitourinary. Option D, Gravity Intake. The correct answer is option B, gastrointestinal. Explanation. The gastrointestinal system includes the stomach and intestines. Question 150. What does the abbreviation HOB stand for? Option A, heart of body. Option B, head of bed. Option C, height of body. Option D, hand over bed. The correct answer is option B, head of bed. Explanation. Instructions often specify a certain angle for the head of the bed. Question 151. What does the abbreviation HOH stand for? Option A, hard of hearing. Option B, head of household. Option C, height of heels. Option D, history of health. The correct answer is option A, hard of hearing. Explanation. Communication techniques should be adjusted for hard of hearing residents. Question 152. What does the abbreviation HR stand for? Option A, health record. Option B, heart rate. Option C, high risk. Option D, hourly report. The correct answer is option B, heart rate. Explanation. The heart rate is measured in beats per minute. Question 153. What does the abbreviation HS stand for in timing? Option A, half strength. Option B, at bedtime. Option C, high stress. Option D, home safety. The correct answer is option B, at bedtime. Explanation. The abbreviation comes from the Latin hora somni. Question 154. What does the abbreviation I and O stand for? Option A, in and out. Option B, intake and output. Option C, internal and occupational. Option D, illness and observation. The correct answer is option B, intake and output. Explanation. Intake and output tracks the amount of fluid a resident consumes and excretes. Question 155. What does the abbreviation ICU stand for? Option A, Individual Care Unit. Option B, Intensive Care Unit. Option C, Intravenous Control Unit. Option D, Infection Control Unit. The correct answer is option B, Intensive Care Unit. Explanation. The intensive care unit provides specialized care for critically ill patients. Question 156. What does the abbreviation IV stand for? Option A, individual visit. Option B, intravenous. Option C, involuntary. Option D, internal valve. The correct answer is option B, intravenous. Explanation. Intravenous means within a vein, usually referring to fluids or medications. Question 157. What does the abbreviation KG stand for? Option A, known group. Option B, kilogram. Option C, knee girth. Option D, key goal. The correct answer is option B, kilogram. Explanation: 1 kilogram is equal to approximately 2.2 pounds. Question 158. What does the abbreviation L stand for on a chart? Option A, large. Option B, left. Option C, low. Option D, liter. The correct answer is option B, left. Explanation: this indicates the left side of the resident's body. Question 159. What does the abbreviation ML stand for? Option A, meter length. Option B, milliliter. Option C, milligram. Option D, monitor level. The correct answer is option B, milliliter. Explanation: milliliters are the metric unit used to measure liquid volume. Question 160. What does the abbreviation MS stand for? Option A, medical staff. Option B, multiple sclerosis. Option C, mental state. Option D, muscle strength. The correct answer is option B, multiple sclerosis. Explanation: multiple sclerosis is a chronic disease that affects the central nervous system. Question 161. What does the abbreviation NG stand for? Option A, near goal. Option B, nasogastric. Option C, normal girth. Option D, nursing group. The correct answer is option B, nasogastric. Explanation: nasogastric refers to a tube that goes from the nose to the stomach. Question 162. What does NKS stand for? Option A, normal knee alignment. Option B, no known allergies. Option C, nursing knowledge area. Option D, new kidney assessment. The correct answer is option B, no known allergies. Explanation: this indicates that a resident has no documented allergies. Question 163. What does NKDS stand for? Option A, normal kidney daily action. Option B, no known drug allergies. Option C, negative knee drive assessment. Option D, nursing key duty assigned. The correct answer is option B, no known drug allergies. Explanation: this means the resident has no known allergies to medications. Question 164. What does NPO stand for? Option A, new patient only. Option B, nothing by mouth. Option C, normal pulse only. Option D, nighttime precision order. The correct answer is option B, nothing by mouth. Explanation: nothing by mouth is a medical order to stop all food and fluid intake. Question 165. What does the abbreviation OS stand for in eye care? Option A, opening system. Option B, left eye. Option C, both eyes. Option D, right eye. The correct answer is option B, left eye. Explanation: the abbreviation comes from the Latin oculus sinister. Question 166. What does the abbreviation OU stand for in eye care? Option A, opening unit. Option B, both eyes. Option C, 1 unit. Option D, only under. The correct answer is option B, both eyes. Explanation: the abbreviation comes from the Latin oculus utic. Question 167. What does the abbreviation PC stand for in medical timing? Option A, post-care. Option B, after meals. Option C, pulse count. Option D, prior to care. The correct answer is option B. After meals. Explanation. The abbreviation comes from the Latin post sibum. Question 168. What does the abbreviation PO stand for? Option A, phone order. Option B, by mouth. Option C, partial observation. Option D, post-operative. The correct answer is option B, by mouth. Explanation. The abbreviation comes from the Latin per os, meaning by mouth. Question 169. What does the abbreviation PRN stand for? Option A, primary resident need. Option B, as needed. Option C, partial record note. Option D, physician resident now. The correct answer is option B, as needed. Explanation. The abbreviation comes from the Latin pro re nater. Question 170. What does the abbreviation PT stand for? Option A, point. Option B, patient. Option C, pulse time. Option D, partial. The correct answer is option B, patient. Explanation. This is a common shorthand for a person receiving care. Question 171. What does the abbreviation Q stand for? Option A, quiet. Option B, every. Option C, quantity. Option D, quick. The correct answer is option B, every. Explanation. The abbreviation comes from the Latin quisque, meaning every. Question 172. What does the abbreviation OD stand for in eye care? Option A, open daily. Option B, right eye. Option C, optical depth. Option D, only during. The correct answer is option B, right eye. Explanation. The abbreviation comes from the Latin oculus dexter. Question 173. What does the abbreviation everyday stand for? Option A, quarterly dose. Option B, every day. Option C, quiet day. Option D, quality delivery. The correct answer is option B, every day. Explanation. The abbreviation comes from the Latin quack die. Question 174. What does the abbreviation QH stand for? Option A, quiet hour. Option B, every hour. Option C, quantity high. Option D, quick help. The correct answer is option B, every hour. Explanation. The abbreviation comes from the Latin quack horror. Question 175. What does the abbreviation every 4 hours stand for? Option A, quality for health. Option B, every 4 hours. Option C, quantity for hourly. Option D, quick for hits. The correct answer is option B, every 4 hours. Explanation. This means a task is performed at 4-hour intervals. Question 176. What does the abbreviation QID stand for? Option A, once a day. Option B, 4 times a day. Option C, quality in detail. Option D, quick internal drain. The correct answer is option B, 4 times a day. Explanation. The abbreviation comes from the Latin quater in die. Question 177. What does the abbreviation QOD stand for? Option A, quality of diet. Option B, every other day. Option C, quiet observation dose. Option D, quick onset daily. The correct answer is option B, every other day. Explanation. This means a task is performed on alternating days. Question 178. What does the abbreviation R stand for on a chart? Option A, rectal. Option B, right. Option C, rest. Option D, respiration. The correct answer is option B, right. Explanation. This indicates the right side of the resident's body. Question 179. What does the abbreviation S with a line over it stand for? Option A, with. Option B, without. Option C, stable. Option D, small. The correct answer is option B, without. Explanation. The abbreviation comes from the Latin sign meaning without. Question 180. What does the abbreviation SOB stand for? Option A, stable or balanced. Option B, shortness of breath. Option C, skin on bone. Option D, side of bed. The correct answer is option B, shortness of breath. Explanation. Shortness of breath is also known as dyspnea. Question 181. What does the abbreviation TID stand for? Option A, twice a day. Option B, 3 times a day. Option C, 10 times daily. Option D, total intake daily. The correct answer is option B, 3 times a day. Explanation. The abbreviation comes from the Latin ter in die. Question 182. What does the abbreviation US stand for? Option A, unit assistant. Option B, urinalysis. Option C, underarm. Option D, upper abdomen. The correct answer is option B, urinalysis. Explanation. Urinalysis is a laboratory test of the urine. Question 183. What does the abbreviation UTI stand for? Option A, upper tissue injury. Option B, urinary tract infection. Option C, under threshold intake. Option D, unstable temperature increase. The correct answer is option B, urinary tract infection. Explanation. Urinary tract infections are very common among nursing home residents. Question 184. What specific factor of hand washing is most responsible for removing germs? Option A, the temperature of the water. Option B, friction. Option C, the scent of the soap. Option D, the brand of paper towel. The correct answer is option B, friction. Explanation. The mechanical action of rubbing the skin removes pathogens. Question 185. On which side should a resident hold a cane for the best support? Option A, the weak side. Option B, the strong side. Option C, the side the resident prefers. Option D, it does not matter. The correct answer is option B, the strong side. Explanation. Holding the cane on the strong side helps offset weight from the weak side. Question 186. If a resident has had a stroke and their left side is weak, which side do you dress first? Option A, the right side. Option B, the left side. Option C, the side with the best circulation. Option D, the side without the hospital band. The correct answer is option B, the left side. Explanation. Always dress the weak or affected side first to ensure proper positioning. Question 187. When restocking a resident's room with supplies, where should the new items go? Option A, on top of the old supplies. Option B, behind the existing supplies. Option C, in the hallway. Option D, on the floor. The correct answer is option B, behind the existing supplies. Explanation. First in, first out rotation ensures that supplies do not expire. Question 188. What is the correct way to apply a gait belt? Option A, apply it loosely around the neck. Option B, apply it around the waist with a buckle off to the side. Option C, apply it over the bare skin. Option D, apply it as tight as possible around the chest. The correct answer is option B. Apply it around the waist with a buckle off to the side. Explanation. Correct application ensures the belt does not slide and provides a secure grip. Question 189. Where does the nursing assistant record the resident's fluid intake and output? Option A, on the resident's door. Option B, on the flow or graphic sheet. Option C, in the resident's diary. Option D, on the kitchen menu. The correct answer is option B, on the flow or graphic sheet. Explanation. Accurate recording is necessary to monitor the resident's hydration and health status. Question 190. Where should a used ostomy pouch be disposed of? Option A, in the regular trash can. Option B, in a biohazard bag. Option C, in the laundry hamper. Option D, down the toilet. The correct answer is option B, in a biohazard bag. Explanation. Ostomy pouches contain body waste and must be handled as biohazardous material. Question 191. What is the appropriate diet for a resident with dysphagia? Option A, high fiber and seeds. Option B, thickened liquids. Option C, whole meats and raw vegetables. Option D, clear liquids only. The correct answer is option B, thickened liquids. Explanation. Thickened liquids are easier to control and swallow, reducing the risk of aspiration. Question 192. What is the number one thing that a nursing assistant should report to the nurse immediately? Option A, a resident who is sleeping. Option B, a resident who has trouble breathing. Option C, a resident who refuses a snack. Option D, a resident who wants to watch television. The correct answer is option B, a resident who has trouble breathing. Explanation. Respiratory distress is a medical emergency that requires immediate intervention. Question 193. What is atrophy? Option A, the growth of a muscle. Option B, the wasting away or decrease in size of a muscle. Option C, a type of severe headache. Option D, the process of a wound healing. The correct answer is option B, the wasting away or decrease in size of a muscle. Explanation. Atrophy is common in residents who are immobile or have certain diseases. Question 194. How many milliliters are in 1 fluid ounce? Option A, 10. Option B, 30. Option C, 60. Option D, 100. The correct answer is option B, 30. Explanation. 30 milliliters is the standard medical conversion for 1 ounce. Question 195. What is the most common cause of choking in a care facility? Option A, drinking water too fast. Option B, a large, poorly chewed piece of meat. Option C, taking a large pill. Option D, eating a bowl of soup. The correct answer is option B, a large, poorly chewed piece of meat. Explanation. Properly prepared food and monitoring during meals can prevent choking. Question 196. Why is there a small hole at the bottom of anti-embolism stockings? Option A, to allow the feet to breathe. Option B, to check circulation in the toes. Option C, because they are poorly made. Option D, to help pull them on. The correct answer is option B, to check circulation in the toes. Explanation. Checking for color and warmth through the hole allows monitoring of blood flow. Question 197. When do most falls occur in a nursing home? Option A, at night and after meals. Option B, during the middle of the day. Option C, during the morning shift change. Option D, only during activities. The correct answer is option A, at night and after meals. Explanation: fatigue and increased confusion at night contribute to higher fall risks. Question 198. What is the difference between grab bars and hand rails? Option A, hand rails are in the bathroom and grab bars are in the hall. Option B, hand rails are in the hallway and grab bars are in the bathroom. Option C, there is no difference between them. Option D, grab bars are for the bed and hand rails are for chairs. The correct answer is option B. Hand rails are in the hallway and grab bars are in the bathroom. Explanation: both are safety features designed to help residents maintain their balance. Question 199. How can Clostridium difficile be killed effectively? Option A, with an alcohol-based hand sanitizer. Option B, with soap and water. Option C, by using a dry paper towel. Option D, with clear water only. The correct answer is option B, with soap and water. Explanation: friction and soap are necessary to remove the spores of Clostridium difficile. Question 200. What is involuntary seclusion? Option A, allowing a resident to be alone in their room. Option B, separating a person from others against his or her will. Option C, giving a resident a private bath. Option D, taking a resident to a quiet activity. The correct answer is option B, separating a person from others against his or her will. Explanation: involuntary seclusion is a form of resident abuse and is illegal. Question 201. If a resident starts to fall, what should the nursing assistant do? Option A, try to grab their arm and pull them up. Option B, ease them to the floor. Option C, step back and watch them fall. Option D, scream for a chair. The correct answer is option B, ease them to the floor. Explanation: easing the resident down prevents injury to both the resident and the assistant. Question 202. What is the primary goal of a bladder training program? Option A, to force the resident to drink more water. Option B, to gain control of urination. Option C, to ensure the resident uses a diaper. Option D, to stop the resident from urinating at night. The correct answer is option B, to gain control of urination. Explanation: bladder training helps residents regain continence and independence. Question 203. How long do you wait to take an oral temperature after a resident eats, drinks, or smokes? Option A, 2 minutes. Option B, 15 to 20 minutes. Option C, 1 hour. Option D, no wait is required. The correct answer is option B, 15 to 20 minutes. Explanation: waiting ensures the oral cavity temperature has returned to its normal baseline. Question 204. What is a condom catheter? Option A, a tube inserted into the bladder. Option B, a soft sheath that slides over the penis to collect urine. Option C, a device used to drain a wound. Option D, a type of internal female catheter. The correct answer is option B, a soft sheath that slides over the penis to collect urine. Explanation: condom catheters are non-invasive and used for male residents with incontinence. Question 205. What are common signs of an infection? Option A, hunger and thirst. Option B, redness, sweating, fatigue, and fever. Option C, being happy and energetic. Option D, having clear urine. The correct answer is option B, redness, sweating, fatigue, and fever. Explanation. Physical changes like fever and fatigue often signal the body is fighting an infection. Question 206. Which two bloodborne pathogens are of the most concern in healthcare? Option A, influenza and the common cold. Option B, human immunodeficiency virus and hepatitis B. Option C, staphylococcus and streptococcus. Option D, measles and mumps. The correct answer is option B, human immunodeficiency virus and hepatitis B. Explanation. Standard precautions are designed to protect against these serious bloodborne diseases. Question 207. What kind of gloves should you use when cleaning up a chemical spill? Option A, standard latex gloves. Option B, rubber utility gloves. Option C, no gloves are needed for cleaning. Option D, plastic food service gloves. The correct answer is option B, rubber utility gloves. Explanation. Utility gloves provide better protection against harsh cleaning chemicals. Question 208. What should be used to clean the drain on a urinary drainage bag? Option A, a wet washcloth. Option B, an alcohol wipe. Option C, a dry paper towel. Option D, strong bleach. The correct answer is option B, an alcohol wipe. Explanation. Alcohol wipes disinfect the port to prevent bacteria from entering the drainage system. Question 209. What does a pulse oximeter measure? Option A, blood pressure and temperature. Option B, oxygen percentage in the blood and heart rate. Option C, respiration rate and height. Option D, the amount of urine output. The correct answer is option B, oxygen percentage in the blood and heart rate. Explanation. A pulse oximeter provides a quick assessment of a resident's respiratory status. Question 210. What is the normal range for oxygen concentration measured by a pulse oximeter? Option A, 80% to 90%. Option B, 95% to 100%. Option C, 50% to 60%. Option D, 100% to 110%. The correct answer is option B, 95% to 100%. Explanation. Levels below 95% should be reported to the nurse immediately. Question 211. What is peristalsis? Option A, a type of heart condition. Option B, involuntary muscle movement throughout the digestive tract. Option C, the process of breathing. Option D, the way a person walks. The correct answer is option B, involuntary muscle movement throughout the digestive tract. Explanation. Peristalsis moves food and waste through the stomach and intestines. Question 212. What is the typical consistency of stools from a colostomy? Option A, always liquid. Option B, semi-liquid to formed. Option C, hard and dry. Option D, clear and watery. The correct answer is option B, semi-liquid to formed. Explanation. The consistency depends on where the colostomy is located in the large intestine. Question 213. What is the typical consistency of stools from an ileostomy? Option A, formed and hard. Option B, liquid. Option C, thick and pasty. Option D, solid like a normal bowel movement. The correct answer is option B, Liquid. Explanation. Because the large intestine is bypassed, the stool remains in a liquid state. Question 214. What are the two primary types of communication? Option A, loud and quiet. Option B, verbal and non-verbal. Option C, fast and slow. Option D, happy and sad. The correct answer is option B, verbal and non-verbal. Explanation. Nonverbal communication includes body language, gestures, and facial expressions. Question 215. What is the appropriate temperature for a soapsuds enema? Option A, 120 degrees Fahrenheit. Option B, 105 degrees Fahrenheit. Option C, 90 degrees Fahrenheit. Option D, 70 degrees Fahrenheit. The correct answer is option B, 105 degrees Fahrenheit. Explanation. Water that is too hot can burn the resident, and too cold can cause cramping. Question 216. What conditions generally promote the growth of bacteria? Option A, light, cold, and dry areas. Option B, dark, warm, and moist areas. Option C, bright, hot, and sunny areas. Option D, clean, sterilized, and frozen areas. The correct answer is option B, dark, warm, and moist areas. Explanation. Maintaining a clean and dry environment is key to preventing bacterial growth. Question 217. What temperature of water should you use to clean dentures? Option A, hot boiling water. Option B, cool or lukewarm water. Option C, freezing cold water. Option D, no water is needed. The correct answer is option B, cool or lukewarm water. Explanation. Cool water prevents the denture material from warping or losing its shape. Question 218. Which condition is a barrel chest commonly correlated with? Option A, dementia. Option B, emphysema. Option C, arthritis. Option D, diabetes. The correct answer is option B, emphysema. Explanation. The lungs stay overinflated with air in emphysema, causing the chest to expand. Question 219. What is orthostatic hypotension? Option A, high blood pressure when sitting. Option B, feeling faint and dizzy when standing up suddenly. Option C, rapid heart rate after exercise. Option D, a type of skin infection. The correct answer is option B, feeling faint and dizzy when standing up suddenly. Explanation. Moving residents slowly and allowing them to dangle prevents orthostatic hypotension. Question 220. What is apnea? Option A, difficulty breathing while exercising. Option B, lack or absence of breathing. Option C, rapid and deep breathing. Option D, a type of severe cough. The correct answer is option B, lack or absence of breathing. Explanation. Apnea is common in sleep apnea and can occur during the dying process. Question 221. What is cyanosis? Option A, a yellow discoloration of the skin. Option B, a blue or gray discoloration of the skin. Option C, a red and itchy rash. Option D, a sudden loss of memory. The correct answer is option B, a blue or gray discoloration of the skin. Explanation. Cyanosis indicates that the body's tissues are not receiving enough oxygen. Question 222. What is hyperventilation? Option A, slow and shallow breathing. Option B, rapid and deep breathing. Option C, normal breathing at rest. Option D, holding your breath for a long time. The correct answer is option B, rapid and deep breathing. Explanation. Hyperventilation is often caused by anxiety or pain and affects oxygen levels. Question 223. What is hypoventilation? Option A, rapid and deep breathing. Option B, slow and shallow breathing. Option C, the process of breathing out. Option D, absence of breathing. The correct answer is option B, slow and shallow breathing. Explanation. Hypoventilation can lead to a dangerous buildup of carbon dioxide in the body. Question 224. What is hypoxia? Option A, when the body has too much oxygen. Option B, when cells do not have enough oxygen. Option C, the process of digestion. Option D, a type of blood clot. The correct answer is option B, when cells do not have enough oxygen. Explanation. Hypoxia is a life-threatening condition that requires immediate oxygen therapy. Question 225. Chronic obstructive pulmonary disease typically involves which two disorders? Option A, pneumonia and bronchitis. Option B, chronic bronchitis and emphysema. Option C, asthma and the common cold. Option D, lung cancer and tuberculosis. The correct answer is option B, chronic bronchitis and emphysema. Explanation. Both disorders damage the airways and make it difficult for the person to breathe. Question 226. What should you use when giving mouth care to an unconscious resident? Option A, a standard toothbrush and paste. Option B, a soft toothette or sponge swab. Option C, a wet washcloth with soap. Option D, a piece of dry gauze. The correct answer is option B, a soft toothette or sponge swab. Explanation. Toothettes are gentle and prevent the resident from accidentally biting a toothbrush. Question 227. What should you do when cleaning a resident's dentures in the sink? Option A, hold them with both hands and no water. Option B, place a hand towel in the sink or fill it with water. Option C, use a strong metal scrub brush. Option D, leave the drain open. The correct answer is option B. Place a hand towel in the sink or fill it with water. Explanation. Patting the sink prevents the dentures from breaking if they are dropped. Question 228. What is the most serious physical risk for a resident in restraints? Option A, feeling sad. Option B, strangulation or death. Option C, loss of appetite. Option D, having messy hair. The correct answer is option B, strangulation or death. Explanation. Residents can become entangled in restraints, leading to severe injury or death. Question 229. A cataract is an eye disorder in which of the following occurs? Option A, the person becomes completely blind suddenly. Option B, the lens of the eye becomes cloudy. Option C, the person has too much pressure in the eye. Option D, the person sees bright flashes of light. The correct answer is option B. The lens of the eye becomes cloudy. Explanation. Cataracts cause blurred vision and can usually be treated with surgery. Question 230. What does the term arthritis mean? Option A, a broken bone. Option B, inflammation of the joints. Option C, a type of skin rash. Option D, the loss of muscle mass. The correct answer is option B, inflammation of the joints. Explanation. Arthritis causes pain, swelling, and stiffness in the affected joints. Question 231. What is geriatrics? Option A, the care of children. Option B, the care of aging people. Option C, the study of plants. Option D, the management of a facility. The correct answer is option B, the care of aging people. Explanation: geriatrics focuses on the unique health needs of the elderly population. Question 232. What is gerontology? Option A, the process of a wound healing. Option B, the study of the aging process. Option C, the study of heart disease. Option D, the process of human birth. The correct answer is option B, the study of the aging process. Explanation: gerontology includes the physical, mental, and social changes in people as they age. Question 233. Which professionals make up the primary nursing team? Option A, the doctor, surgeon, and pharmacist. Option B, the registered nurse, licensed practical nurse, and certified nursing assistant. Option C, the social worker, chaplain, and dietitian. Option D, the resident, family, and visitors. The correct answer is option B, the registered nurse, licensed practical nurse, and certified nursing assistant. Explanation: the nursing team works together to provide direct daily care to the residents. Question 234. What is an invasion of privacy? Option A, reporting a resident's fever to the nurse. Option B, violating a person's right to keep their body and affairs private. Option C, knocking on a resident's door before entering. Option D, closing the curtain during a bath. The correct answer is option B, violating a person's right to keep their body and affairs private. Explanation: protecting privacy is a legal and ethical requirement for all healthcare staff. Question 235. What does the acronym HIPAA stand for? Option A, Health Intake and Patient Assessment Act. Option B, Health Insurance Portability and Accountability Act. Option C, Hourly Informed Patient Activity Area. Option D, Hospital Information and Privacy Access Agency. The correct answer is option B, Health Insurance Portability and Accountability Act. Explanation: this federal law protects the confidentiality and security of a person's health information. Question 236. What is a medical record? Option A, a resident's personal diary. Option B, a written or electronic account of a person's condition and response to care. Option C, a list of the resident's favorite foods. Option D, a document that belongs to the resident's family. The correct answer is option B, a written or electronic account of a person's condition and response to care. Explanation: the medical record is a legal document used to coordinate care among the team. Question 237. In terms of documentation, what is objective data? Option A, information that a person tells you. Option B, information that is seen, heard, felt, or smelled. Option C, the opinions of the nursing assistant. Option D, a guess about a resident's health. The correct answer is option B, information that is seen, heard, felt, or smelled. Explanation: objective data is also known as signs and can be measured or observed. Question 238. In terms of documentation, what is subjective data? Option A, information you can see with your eyes. Option B, information a person tells you that you cannot observe through your senses. Option C, the resident's pulse and blood pressure. Option D, the weight of the resident. The correct answer is option B, information a person tells you that you cannot observe through your senses. Explanation: Subjective data is also known as symptoms, such as the resident saying they have a headache. Question 239. How should you respond to a resident who exhibits demanding behavior? Option A. Ignore them until they are quiet. Option B. Treat them with dignity and try to understand the cause of the behavior. Option C. Tell them they are being rude. Option D. Report them to the police. The correct answer is option B. Treat them with dignity and try to understand the cause of the behavior. Explanation. Patience and empathy are necessary to handle residents who may be frustrated or in pain. Question 240. What is self-centered behavior in a resident? Option A. Caring about the needs of others first. Option B. Behaving as if everything is about them and ignoring the needs of others. Option C. Being very quiet and withdrawn. Option D. Helping the staff with their duties. The correct answer is option B. Behaving as if everything is about them and ignoring the needs of others. Explanation. This behavior is often a result of the resident's loss of control over their own life. Question 241. What does MSDS stand for in facility safety? Option A. Medical Staff Duty Schedule. Option B. Material Safety Data Sheet. Option C. Minimum Standard for Daily Service. Option D. Manual Safety Device System. The correct answer is option B. Material Safety Data Sheet. Explanation. The Material Safety Data Sheet provides information on how to handle chemicals safely. Question 242. How should a stretcher be moved down a hallway? Option A. Pushed by one person head first. Option B. Pushed by two people with the resident's feet first. Option C. Pulled by one person from the side. Option D. Quickly so the resident doesn't get bored. The correct answer is option B. Pushed by two people with the resident's feet first. Explanation. Two people are needed for safety, and moving feet first prevents the resident from becoming dizzy. Question 243. What is the leading cause of death among persons aged 65 and older? Option A. Infections. Option B. Falls. Option C. Heart attacks. Option D. Diabetes. The correct answer is option B. Falls. Explanation. Falls often lead to fractures and a decline in overall health in the elderly. Question 244. When do most falls occur in long-term care facilities? Option A. During the morning shift change. Option B. During the night and after meals. Option C. During lunchtime. Option D. Only on the weekends. The correct answer is option B. During the night and after meals. Explanation. Reduced lighting and increased confusion at night contribute to fall risks. Question 245. All of the following are common causes of falls except which one? Option A. Poor lighting and cluttered floors. Option B. Wet and slippery floors. Option C. Properly fitting non-skid shoes. Option D. Bathtubs and showers. The correct answer is option C. Properly fitting non-skid shoes. Explanation. Safe footwear is a primary way to prevent falls, not cause them. Question 246. Is every resident in a nursing home permitted to use bed rails? Option A. Yes, everyone needs them for safety. Option B. No, they are only used if ordered and for specific medical needs. Option C. Only if the resident's family pays for them. Option D. Only at night. The correct answer is option B. No, they are only used if ordered and for specific medical needs. Explanation. Bed rails can be dangerous and are considered a restraint in many situations. Question 247. Where are hand rails typically located in a facility? Option A, in the bathroom. Option B, in the hallways. Option C, on the side of the bed. Option D, in the kitchen. The correct answer is option B, in the hallways. Explanation. Hand rails help residents maintain balance as they walk through the building. Question 248. Where are grab bars typically located in a facility? Option A, in the hallways. Option B, in the bathroom. Option C, on the resident's chair. Option D, in the elevator. The correct answer is option B, in the bathroom. Explanation. Grab bars are used to help residents move safely on and off the toilet or in the shower. Question 249. When is the device called a transfer belt? Option A, when helping a person walk. Option B, when moving a person from one place to another, such as bed to chair. Option C, when the resident is sleeping. Option D, when used as a restraint. The correct answer is option B, when moving a person from one place to another, such as bed to chair. Explanation. Transfer belts provide a secure place for the assistant to grip during a move. Question 250. When is the device called a gait belt? Option A, when helping a person walk or ambulate. Option B, when transferring a person into a bathtub. Option C, when the resident is in a wheelchair. Option D, when it is being washed. The correct answer is option A, when helping a person walk or ambulate. Explanation. A gait belt helps the assistant support the resident's balance during walking. Question 251. What could be a serious consequence of a resident laying flat on their back for too long? Option A, improved circulation. Option B, pneumonia. Option C, increased muscle strength. Option D, better sleep. The correct answer is option B, pneumonia. Explanation. Immobility allows fluid to collect in the lungs, increasing the risk of infection. Question 252. What is the definition of a non-pathogen? Option A, a microbe that causes a severe infection. Option B, a microbe that does not cause infection and is often beneficial. Option C, a type of cleaning chemical. Option D, a person who is not sick. The correct answer is option B, a microbe that does not cause infection and is often beneficial. Explanation. Many non-pathogens live on the skin and in the digestive tract to help the body. Question 253. What is sepsis? Option A, a minor cut on the finger. Option B, a systemic infection throughout the entire body. Option C, a type of skin ulcer. Option D, the process of a wound healing. The correct answer is option B, a systemic infection throughout the entire body. Explanation. Sepsis is a medical emergency that can lead to organ failure and death. Question 254. What is the first link in the chain of infection? Option A, the portal of entry. Option B, the source or causative agent. Option C, the method of transmission. Option D, the susceptible host. The correct answer is option B, the source or causative agent. Explanation. The infection starts with a pathogen, such as a bacteria or virus. Question 255. What is medical asepsis also known as? Option A, sterile technique. Option B, clean technique. Option C, contamination. Option D, disinfection. The correct answer is option B. Clean technique. Explanation. Medical asepsis involves removing or destroying pathogens to prevent their spread. Question 256. What is the process of sterilization? Option A. Washing with regular soap. Option B. The total absence of all microbes, including spores. Option C. Using an alcohol-based hand rub. Option D. Cleaning a room with bleach. The correct answer is option B. The total absence of all microbes, including spores. Explanation. Sterilization is used for instruments that enter the human body. Question 257. Which precaution should be used for a resident with the flu? Option A. Airborne precautions. Option B. Droplet precautions. Option C. Standard precautions only. Option D. Contact precautions only. The correct answer is option B. Droplet precautions. Explanation. Droplet precautions protect against pathogens spread through coughing and sneezing. Question 258. Which precaution is specifically used for a resident with tuberculosis? Option A. Contact precautions. Option B. Airborne precautions. Option C. Droplet precautions. Option D. No precautions are needed. The correct answer is option B. Airborne precautions. Explanation. Airborne precautions require a special respirator mask and a negative pressure room. Question 259. Ergonomics is best defined as which of the following? Option A. The study of human behavior. Option B. The science of designing a job to fit the worker. Option C. The study of the aging process. Option D. A type of physical therapy. The correct answer is option B. The science of designing a job to fit the worker. Explanation. Ergonomics helps prevent workplace injuries like back strain. Question 260. What is an exposure incident? Option A. When a resident is exposed to the cold. Option B. When a staff member is splattered by blood or has a needle stick. Option C. When a resident's privacy is violated. Option D. When a facility loses power. The correct answer is option B. When a staff member is splattered by blood or has a needle stick. Explanation. Exposure incidents must be reported and followed by immediate medical evaluation. Question 261. Log rolling is a technique used to turn a person as a unit while maintaining what? Option A. Speed. Option B. Proper alignment of the spine. Option C. The resident's comfort only. Option D. The nursing assistant's height. The correct answer is option B. Proper alignment of the spine. Explanation. Log rolling is used for residents with spinal or hip injuries. Question 262. What is the common saying used to remember how to position a resident with a pale face? Option A. Face is pale, raise the head. Option B. Face is pale, raise the tail or feet. Option C. Face is pale, call for help. Option D. Face is pale, give them water. The correct answer is option B. Face is pale, raise the tail or feet. Explanation. Raising the feet helps increase blood flow to the brain when a person is pale. Question 263. What is the common saying used to remember how to position a resident with a red face? Option A. Face is red, raise the feet. Option B. Face is red, raise the head. Option C. Face is red, turn them over. Option D. Face is red, keep them flat. The correct answer is option B. Face is red, raise the head. Explanation. Raising the head helps decrease pressure in the brain when a person is flushed. Question 264. What is entrapment? Option A, when a resident is locked in their room. Option B, when a person gets caught or entangled in spaces created by bed rails or mattresses. Option C, a type of mental health disorder. Option D, when a resident refuses to leave the facility. The correct answer is option B, when a person gets caught or entangled in spaces created by bed rails or mattresses. Explanation: entrapment can lead to serious injury or strangulation and must be prevented. Question 265. What information must be labeled on a resident's denture cup? Option A, the resident's age and weight. Option B, the resident's name, room number, and bed number. Option C, the date the dentures were purchased. Option D, the name of the resident's doctor. The correct answer is option B, the resident's name, room number, and bed number. Explanation: proper labeling prevents personal items from being lost or given to the wrong person. Question 266. What does it mean if a resident is diaphoretic? Option A, they are having a seizure. Option B, they are sweating heavily. Option C, they are unable to speak. Option D, they are extremely hungry. The correct answer is option B, they are sweating heavily. Explanation: diaphoresis can be a sign of pain, fever, or a medical emergency like a heart attack. Question 267. What does jaundice refer to? Option A, the skin turning blue. Option B, the skin turning yellow. Option C, a red and itchy rash. Option D, the loss of hair. The correct answer is option B, the skin turning yellow. Explanation: jaundice often indicates a problem with the liver or gallbladder. Question 268. Which areas are washed during a partial bath? Option A, the entire body from head to toe. Option B, the face, hands, underarms, back, buttocks, and perineal area. Option C, only the arms and legs. Option D, only the hair and nails. The correct answer is option B, the face, hands, underarms, back, buttocks, and perineal area. Explanation: a partial bath focuses on the areas that develop odors or require frequent cleaning. Question 269. What is alopecia? Option A, excessive body hair. Option B, the loss of hair or baldness. Option C, a type of skin infection. Option D, a condition that affects the nails. The correct answer is option B, the loss of hair or baldness. Explanation: alopecia can be caused by aging, medication, or medical conditions. Question 270. What is hirsutism? Option A, the loss of hair. Option B, excessive body hair in unusual places. Option C, a type of severe dandruff. Option D, a condition where nails grow too fast. The correct answer is option B, excessive body hair in unusual places. Explanation: hirsutism is often caused by hormonal changes in the body. Question 271. What is scabies? Option A, a common skin rash. Option B, a skin disorder caused by a female mite that burrows under the skin. Option C, a bacterial infection of the lungs. Option D, a type of allergic reaction to soap. The correct answer is option B, a skin disorder caused by a female mite that burrows under the skin. Explanation: scabies is highly contagious and requires specific medical treatment and isolation. Question 272. What is pediculosis? Option A, an infection of the feet. Option B, the medical term for a lice infestation. Option C, a type of skin ulcer. Option D, the loss of the sense of smell. The correct answer is option B, the medical term for a lice infestation. Explanation: lice can affect the head, body, or pubic area and spreads through direct contact. Question 273. When should a nursing assistant avoid using a safety razor on a resident? Option A, if the resident is using blood thinners or anticoagulants. Option B, if the resident has white hair. Option C, if the resident is sleeping. Option D, if the resident is very old. The correct answer is option A, if the resident is using blood thinners or anticoagulants. Explanation: blood thinners increase the risk of severe bleeding from even a small nick or cut. Question 274. How much water does an average adult need daily to maintain health? Option A, 500 milliliters. Option B, 1,500 milliliters. Option C, 5,000 milliliters. Option D, 1 gallon every hour. The correct answer is option B, 1,500 milliliters. Explanation: adequate hydration is necessary for all body systems to function properly. Question 275. How should you describe the location of food on a plate for a visually impaired resident? Option A, by pointing at the food. Option B, by using the numbers on a clock face. Option C, by telling them it all tastes good. Option D, by moving the plate around. The correct answer is option B, by using the numbers on a clock face. Explanation: telling a resident that meat is at 6 o'clock and peas are at 2 o'clock helps them eat independently. Question 276. How many pounds are in 1 kilogram? Option A, 1 pound. Option B, 2.2 pounds. Option C, 5 pounds. Option D, 10 pounds. The correct answer is option B, 2.2 pounds. Explanation: medical weights are often recorded in kilograms and must be converted accurately. Question 277. A resident is 4 feet tall. How many inches is this? Option A, 40 inches. Option B, 48 inches. Option C, 52 inches. Option D, 60 inches. The correct answer is option B, 48 inches. Explanation: multiplying 4 feet by 12 inches equals 48 inches. Question 278. A resident is 5 feet tall. How many inches is this? Option A, 50 inches. Option B, 60 inches. Option C, 70 inches. Option D, 80 inches. The correct answer is option B, 60 inches. Explanation: multiplying 5 feet by 12 inches equals 60 inches. Question 279. A resident is 6 feet tall. How many inches is this? Option A, 66 inches. Option B, 72 inches. Option C, 78 inches. Option D, 84 inches. The correct answer is option B, 72 inches. Explanation: multiplying 6 feet by 12 inches equals 72 inches. Question 280. When can a random urine sample be collected? Option A, only in the morning. Option B, at any time during a 24-hour period. Option C, only after the resident has eaten. Option D, only once a week. The correct answer is option B, at any time during a 24-hour period. Explanation: Random samples are used for basic screenings and do not require a specific time. Question 281. What is the clinical term for sugar in the urine? Option A, hematuria. Option B, glucosuria or glycosuria. Option C, proteinuria. Option D, puria. The correct answer is option B, glucosuria or glycosuria. Explanation. Sugar in the urine is a common finding in residents with uncontrolled diabetes. Question 282. What are reagent strips used for in urine testing? Option A, to measure the amount of urine output. Option B, to measure substances like sugar or ketones in the urine. Option C, to clean the specimen container. Option D, to filter out bacteria from the urine. The correct answer is option B, to measure substances like sugar or ketones in the urine. Explanation. The strips change color when they react with specific chemicals in the urine. Question 283. When is the best time to collect a sputum specimen? Option A, right before bedtime. Option B, first thing in the morning. Option C, immediately after a meal. Option D, in the middle of the night. The correct answer is option B, first thing in the morning. Explanation. Sputum is more concentrated and easier to expectorate after sleeping. Question 284. What is orthostatic hypotension? Option A, high blood pressure while lying down. Option B, a drop in blood pressure when the person stands up suddenly. Option C, a rapid heart rate during exercise. Option D, a type of lung infection. The correct answer is option B, a drop in blood pressure when the person stands up suddenly. Explanation. Dangling the resident at the bedside helps prevent this condition. Question 285. What is aphasia? Option A, the loss of the ability to walk. Option B, the loss of the ability to speak or understand language. Option C, a type of severe skin rash. Option D, the inability to swallow food. The correct answer is option B, the loss of the ability to speak or understand language. Explanation. Aphasia is common after a stroke or in advanced dementia. Question 286. What is acquired immunodeficiency syndrome caused by? Option A, a bacterial infection. Option B, the human immunodeficiency virus. Option C, aging. Option D, poor nutrition. The correct answer is option B, the human immunodeficiency virus. Explanation. The human immunodeficiency virus attacks the body's immune system. Question 287. What is the final outcome of Alzheimer's disease? Option A, it is eventually cured with surgery. Option B, it always ends in death. Option C, the person regains their memory over time. Option D, it only affects the ability to walk. The correct answer is option B, it always ends in death. Explanation. Alzheimer's is a progressive, terminal brain disease. Question 288. What happens to a person's level of consciousness during shock? Option A, they become very energetic. Option B, they may become confused or lose consciousness. Option C, they have no change in consciousness. Option D, they become very happy. The correct answer is option B. They may become confused or lose consciousness. Explanation. Shock prevents the brain from receiving enough oxygenated blood. Question 289. In the FAST acronym for strokes, what does the letter F stand for? Option A, fever. Option B, facial drooping. Option C, fainting. Option D, feet. The correct answer is option B, facial drooping. Explanation. Checking if one side of the face sags is a key way to identify a stroke. Question 290. In the FAST acronym for strokes, what does the letter A stand for? Option A, appetite. Option B, arms and whether one will not raise. Option C, aches and pains. Option D, ambulating. The correct answer is option B, arms and whether one will not raise. Explanation. Weakness in one arm is a common sign of a cerebrovascular accident. Question 291. In the FAST acronym for strokes, what does the letter S stand for? Option A, sleeping. Option B, slurred language or speech. Option C, sweating. Option D, sensation. The correct answer is option B, slurred language or speech. Explanation. Difficulty speaking or understanding others can indicate a brain injury from a stroke. Question 292. In the FAST acronym for strokes, what does the letter T stand for? Option A, temperature. Option B, time is of the essence. Option C, touch. Option D, taste. The correct answer is option B, time is of the essence. Explanation. Rapid medical treatment is critical to minimize permanent brain damage from a stroke. Question 293. Where inside the lungs does the exchange of oxygen and carbon dioxide happen? Option A, the trachea. Option B, the alveoli. Option C, the bronchi. Option D, the pleura. The correct answer is option B, the alveoli. Explanation. The alveoli are tiny air sacs where gases pass into and out of the blood. Question 294. Why is there a small hole at the bottom of an anti-embolism stocking? Option A, to make it easier to pull on. Option B, to check the circulation in the toes. Option C, to allow the resident to wiggle their toes. Option D, to save on material costs. The correct answer is option B, to check the circulation in the toes. Explanation. The hole allows staff to see if the toes are warm and have a pink color. Question 295. Which nervous system is responsible for the fight or flight response? Option A, the parasympathetic nervous system. Option B, the sympathetic nervous system. Option C, the central nervous system. Option D, the digestive system. The correct answer is option B, the sympathetic nervous system. Explanation. The sympathetic system increases heart rate and blood pressure during stress. Question 296. What is the term for black dead tissue that may be found in a wound? Option A, slough. Option B, eschar. Option C, serum. Option D, pus. The correct answer is option B, eschar. Explanation. Eschar is thick and leathery and must be removed for a wound to heal. Question 297. What is a sepsis? Option A, a serious infection in the blood. Option B, being free of pathogens. Option C, the growth of bacteria. Option D, a type of medical equipment. The correct answer is option B, being free of pathogens. Explanation. Aseptic techniques prevent the transfer of harmful microbes. Question 298. Where is the most common site for a pressure ulcer to develop? Option A, the ear. Option B, the sacrum. Option C, the knee. Option D, the elbow. The correct answer is option B, the sacrum. Explanation. The sacrum bears significant weight when a resident is lying in bed. Question 299. What does it mean if a resident is sedentary? Option A, they are very active and walk a lot. Option B, they are barely moving or stay in one place. Option C, they are very talkative. Option D, they are extremely hungry. The correct answer is option B. They are barely moving or stay in one place. Explanation. Sedentary lifestyles increase the risk of pressure sores and blood clots. Question 300. Where on a manual bed should a Foley drainage bag be hung? Option A, on the side rail. Option B, on the bed frame. Option C, on the footboard. Option D, on the headboard. The correct answer is option B, on the bed frame. Explanation. Hanging the bag on the frame ensures it does not pull when rails are moved. Question 301. Separating a person from others against his or her will is an example of what? Option A, standard care. Option B, involuntary seclusion. Option C, proper isolation. Option D, restorative nursing. The correct answer is option B, involuntary seclusion. Explanation. Involuntary seclusion is a form of abuse and is strictly prohibited. Question 302. What units is blood pressure measured in? Option A, milliliters. Option B, millimeters of mercury. Option C, degrees Fahrenheit. Option D, pounds and ounces. The correct answer is option B, millimeters of mercury. Explanation. Blood pressure readings are recorded as a ratio of systolic over diastolic pressure. Question 303. How often should you check a resident's skin when they have a hot or cold pack applied? Option A, once per shift. Option B, every 5 minutes. Option C, every hour. Option D, only when the pack is removed. The correct answer is option B, every 5 minutes. Explanation. Frequent checks prevent burns or tissue damage from extreme temperatures. Question 304. How often should physical restraints be removed to provide care? Option A, once a day. Option B, every 2 hours. Option C, every 4 hours. Option D, only if the resident asks. The correct answer is option B, every 2 hours. Explanation. Removing restraints every 2 hours allows for movement, skin checks, and toileting. Question 305. What is a bland diet? Option A, a diet that is high in calories and fat. Option B, a diet with no spicy or irritating foods. Option C, a diet that consists only of liquid. Option D, a diet that is served very cold. The correct answer is option B, a diet with no spicy or irritating foods. Explanation. Bland diets are used for residents with digestive issues or ulcers. Question 306. Which blood vessels always flow away from the heart? Option A, veins. Option B, arteries. Option C, capillaries. Option D, venules. The correct answer is option B, arteries. Explanation. Arteries carry oxygenated blood to the tissues of the body. Question 307. Which blood vessels always flow back toward the heart? Option A, arteries. Option B, veins. Option C, arterioles. Option D, capillaries. The correct answer is option B, veins. Explanation. Veins carry deoxygenated blood and waste products back to the heart.